reason why you've been given this tape as my patient is you're suffering from some joint pain, muscle pain, or some type of musculoskeletal problem that I feel this acupuncture technique will help you to quickly recover from. Or maybe you had some chronic problems like fibromyalgia, or some problems like a shoulder problem or a knee problem or a leg problem that's been hurting you for maybe 10 or 15 years. I've come across a technique which I've been working on for several years. It's very, very effective, very quick, and I want to explain it to you today. It's using acupuncture, but it's really a combination of a chiropractic, acupuncture synergism to correct the neurology as well as the muscle itself. I want to explain today what causes pain in muscles, because people don't think that muscle pain is a problem. They go to the emergency room after a big car wreck and they can't move, or they get smashed up in a game of some sort or tear a muscle, and we do an x-ray and there's no fracture, and what does the doctor say? The doctor says, oh, there's nothing wrong, don't worry about it. Well, there is something wrong. The muscles make up about 50% of your body. They're absolutely critical. They hold all the joints where they're supposed to hold them in a particular place. When joints are not in where they're supposed to be, that causes horrendous pain. That's why chiropractic works. We put the joints back where they belong. The muscles are absolutely critical. So if something happens to the muscle and it changes the length of the muscle, then a unique thing happens. Let's go up to the board and I'm going to show you something. Let's take two bones, and we'll just draw a bone, an end of a bone here, and we have the matching bone right here. And these two bones are sitting there, and they have ligaments attached to them here, but they also have big muscles that cross these joints, and these muscles will go across like this. Okay? And there'll be one from over here like this. By the way, this is exactly how muscles are built. You have long tissues like this. This is how muscles contract, this is how muscles expand, just like this. And what ends up happening is the joints here are held exactly where they're supposed to by the muscles. There's little nerve fibers inside of here, inside this joint, that go up to the brain, and they tell the brain, is this joint positioned properly? And if this joint, if this muscle is shortened, let's say we shorten this muscle right here, like this, it's going to pull this joint out of place. It's going to signal the brain, hey, this joint is not in place, and what does it cause? It causes pain. If you don't think that that's the case, you just take your finger like this and bend it for about a half an hour, and you tell me, you don't even have to go half an hour, just a second, it starts hurting. What is that happening? The joint is telling the brain, hey, this finger doesn't belong like this. So you want to put this back. Now, all over our body, these muscles are what hold the joints in place. This is what happens in chiropractic. If the joint's out of place in chiropractic, we manually put the bone back, then the pain is gone. And many of you are experiencing that. But then guess what? 2 days later, it comes back. And this is where the reputation comes. You got to go to a chiropractor over and over and over and over. But if you correct the resting length of these muscles to where they set back where it's supposed to, the pain will go away after we replace the joint in the position. This is where this technique comes in really, really helpful. We can change the resting length of an injured muscle and cause you to have pain relief very quickly, sometimes within just a few minutes. And I want to show you how this is done with acupuncture and this technique we've developed in the clinic. Okay, you need to remember that concept of those two muscles pulling on those bones, taking them out of place. This is what a muscle is built like. You have a long striation here, and you have a long striation here, and you have another one here, and another one here, and then they come down into tendons like this, and then they attach the bones. Okay? Put us a bone on each side here. Now, when you tear a muscle or injure a muscle, As an adult, you heal with scar tissue, not with new muscle. Let me show you this. Here's a cell. You tear it. Right here, you tear it open. It doesn't take this piece of tissue and put it back here. The white blood cells eat that piece of tissue off, and it repairs it with scar tissue. That's the way it is. That's why as we get older, we get stiffer and stiffer and stiffer as we tear ourselves up. That's why these athletes who play football till they're 40 years old can't hardly walk. Their body's tons of scar tissue. Well, in a muscle, if you tear the muscle, just a tiny part of it, down deep inside here, this fiber closes down the muscle, and it closes down the resting length and changes it just a little bit. And if it changes it a little bit, what happens? The bones it is connected to are not going to be in place. Now, up to this point, we really didn't have, up to recently, we really didn't have any way to get down into the depths of this muscle and do anything. We would put pads of physical therapy out here with electrical current, and it would make the muscle bump up and down, but it didn't do anything. And so we'd have to adjust you and adjust you and adjust you. Well, we've done something new. In my clinic, we've been doing it for about 3 years, and it's really been very successful. What we do is we take an acupuncture needle, and we put it here and here. By the way, there's no pain in this, because the only time you'll have pain with an acupuncture needle going into a muscle is if you hit this spot right here, where it's injured. And by the way, the neurology, if you go back to the original tape, there's another nerve sitting here, and it's telling the brain all the time, this thing is not right, and it hurts. So you have muscle pain, and this can go on for years and years and years and years. Now you take an acupuncture needle, and we hook it up to a little machine. It's an electrical current, and these currents are designed, we'll put us a little needle here. So we got a wire here and a wire here. These currents are designed to be almost exactly the same current as the nervous system. And we use different currents for different tissue, but the current is to relax this muscle here. So what we do is when we hook this up and we put the electricity through it, it changes the resting length of this muscle like this. And then the second time you do it, it changes it a little more like this. And pretty soon it gets pretty darn straight. And when it gets straight, what happens? If you notice that this one is longer than this one, that's longer than that one, the resting length of the muscle goes back to normal. And what happens when this goes back to normal? The two bones that it's connected to, they go back to being where they're supposed to belong, and no more pain. This is a fantastic technique. Quite frankly, when I first started doing it, I was shocked myself. I didn't realize how good it was. And we do this an awful lot. This is one of the best techniques I have ever seen. It's better than any injections that are with any type of medication. It's better than anything I've ever seen to change muscle pain and also joint pain. We'll use this quite often for you in the clinic. This technique is very fast. We expect, and I expect, to see pain relief within 10 minutes. Usually, we can get very good results in very difficult cases within 2 to 6 visits. And let me tell you, that's incredible. Back when I first started practicing with people with muscle tears and stuff like that, athletic injuries, it would take me 15, 20 visits to get people functioning again, and then it never really worked right. Now I'm on the field with my little girl's soccer team and all, acupuncturing people on the field, sending them back out there. It's just amazing how well this works. It's not only is it fast, it's painless. Don't be afraid of acupuncture needles. Acupuncture needles, there's something special about acupuncture needles, and I need to explain that to you. And I'll show you why they're painless. A regular needle is shaped like this. It's actually a surgical instrument. It's cut at a beveled angle here, and when it goes through the tissue, it literally slices through, cuts blood vessels, muscles, and everything else. That's why it hurts. An acupuncture needle is shaped like this. When it goes through the tissue, it just pushes tissue aside, and it won't go through blood vessels and all, except the teeny weeny ones. If in fact when I'm putting the needles in you, if you do feel anything at all, you let me know. We just reposition it. But they're very, very thin, and they'll go around any of the important tissue. So you don't have any damage to the tissue whatsoever with an acupuncture needle, where with a regular needle to give shots with, it cuts through the tissue. That's what I'm going to do now is demonstrate the acupuncture technique that I talked about just a moment ago. And if you look down here, this is a very common muscle. This is a calf muscle that to be torn or injured in an athletic injury. We see this very, very often. We also see these muscles in foot problems. When the muscles of the leg that support the foot get injured, they cause the foot to hurt. And we've been able to correct a lot of feet problems by correcting the muscles. What I want to show is how this technique is done. First, I want to show, if we can see this, an acupuncture needle. Here's an acupuncture needle. And I want you to notice how thin it is. It's about as thin as a human hair. And it does not have a beveled end like a standard injection type needle. And that's why it doesn't cause any pain, doesn't do any damage. If you remember on our video, let's say that the muscle that was torn was right here in this area. So what we're going to do is place a needle here and place a needle here on each side of it and pulse it through. And I'll show you how that's done. The needle is placed there. Here. Now this needle is placed down in as deep as I need to go to reach the injured muscle, which may be this far down in there, but I need to get these needles down in where the electrodes will do exactly what we want to do. And next we have a little machine here. This is a machine I was telling you about. And we have certain frequencies we can set. We connect those electrodes up and we pulse the frequency. And the patient is down here for about 10 minutes. And then when it's done, they will get very, very soft. We just remove this. Just like this. This muscle that was all crunched up like this will now be longer, and the pain will go down. It's just that simple. It's a very simple technique. However, it's very important they be placed exactly in the injured spot. And that's where really our hands come in, to put in the right location. When I recommend to you, we do some acupuncture. The kind of acupuncture I showed you today is chiropractic type acupuncture. Classical Chinese acupuncture for changing meridians and all that, I may recommend that also. That's not quite the same thing as this.